We'll proceed with our discussion item. Madam CAO.
Thank you, Madam Chair, members of the board. I'd like to introduce our Public Health Officer, Wilma Wooten, who's going to give you the presentation today. Dr. Wooten, would you like to introduce Eric to everyone, please? Thank you.
Good morning, Chairwoman Jacob, members of the board, and Chief Administrative Officer Helen Robbins-Meyer. On my right is Dr. Erica McDonald, who is our Medical Director for our Epidemiology and Immunization program in the Health and Human Services Agency. And we will start out the presentation this morning with a brief overview from our agency director, Nick, or setup from our director, Nick Macchione.
Thank you, Dr. Wooten. Chairman Jacob, members of the board. On September 1st of this year, the County Public Health Officer, Dr. Wilma Wooten, issued a declaration of local health emergency pursuant to Health and Safety Code 101080 as a result of the outbreak of increasing numbers of Hepatitis A infections. This health and safety code requires that the County Board of Supervisors ratify this declaration of local health emergency within 7 days of being issued. We are here today to seek this ratification. Dr. Wooten will now provide a brief overview of the activities leading up to this declaration. Dr. Wooten.
Thank you, Nick. On March 3rd, 2007, the County Epidemiology Program of the Health and Human Services Agency identified a hepatitis A outbreak primarily in the homeless and illicit drug use population. Today's presentation will provide you with a brief overview of hepatitis A, how it is spread, a description of the cases, and a report on activities conducted since the outbreak was identified. Hepatitis means inflammation of the liver. While heavy alcohol use, toxins, some medications, and certain conditions can cause hepatitis, hepatitis is most commonly caused by a virus. And that includes hepatitis A virus, hepatitis B, as well as hepatitis C. The focus for today's presentation will be on hepatitis A. Hepatitis A can spread from person to person, can cause liver disease lasting a few weeks to a serious illness lasting several months, and can cause death in some cases, as we have seen with this population that we are dealing with now. But generally, if a person is healthy, death is a rare situation with hepatitis A infection. All of the outbreak cases resulting in death have had underlying medical conditions and some may have had either hepatitis A or hepatitis C or both, and they may have had other contributing factors causing chronic liver disease. All cases for which we have information were either homeless or illicit drug users or both. Hepatitis A is usually spread when a person ingests fecal matter, even in a microscopic amount, from contact with objects, food, or drinks contaminated by feces or stool from an infected person. Hepatitis A is spread when an infected person does not wash their hands properly after going to the bathroom and then touches objects and or food, or when a caregiver doesn't properly wash their hands after changing an infant's diaper or cleaning up stool of an infected person, or someone engages in sexual activity with an infected person. Hepatitis A can be spread through contaminated food or water. To date, however, we have not identified a specific source for this hepatitis A outbreak. This outbreak is being spread person to person. The hepatitis A virus is very hardy, with the heating to over 185 degrees required for 1 minute to kill it. Average incubation period for hepatitis A infection is 28 days, but ranging from 15 to 50 days. The virus can live outside the body for months, depending upon the environmental conditions, and adequate chlorination of water does kill the hepatitis A viruses that enter our water supply. Our most important tool to prevent the spread of hepatitis A disease is vaccination. A two-dose series of hepatitis A vaccine is the best way to prevent the infection, but this is a challenge due to the population that we are experiencing with this outbreak. In this next slide, it basically shows you that the hepatitis A vaccine was introduced in 1995. In 1999, California was one of the high risk incidence states and included in the first pilot of this vaccine routinely in children. In 2006, the vaccine was routinely used for all children in the United States. Until this year, San Diego typically has 2 to 3 cases of hepatitis A per month. In 2017, we had a total of 413 cases as depicted by the last bar in the right of the graph here. That includes the 398 or 96% of all of the hepatitis A cases that have been reported this year. The remaining are isolated cases and not associated with the outbreak, and in most cases are travel associated. The next slide basically is what we call an Epicurve or an epidemiology curve showing the dates of onset of the outbreak cases. While the outbreak was first recognized in March, cases can be traced back to November 22nd. We know this based on genotyping that has been provided by the Centers for Disease Control and Prevention to determine if cases are related. On the right side of the graph, it might appear that things are getting better because the histograms are decreasing, but this can be misleading. We are likely to see more cases due to the long incubation period and the time it takes to confirm suspect cases. So the area that's under the red bar, we anticipate we will see more cases for those dates for onset of illness. And currently staff are investigating approximately 40 suspect cases that are being investigated for a determination if these cases are part of the hepatitis A outbreak. So the next slide gives you a description of the cases. As stated before, we have currently, as of yesterday, September 5th, 398 confirmed outbreak cases ranging in onset of illness from November 22nd through August 30th. 70% of these cases have been hospitalized, and this has been constant throughout the outbreak, for much of the outbreak. We've had 15 deaths, and 68% are male, 32% are female, and the age ranges from 5 years of age to 87 years of age. And that one case at 5, that's a 5-year-old, had not been vaccinated, and I think that is also the only child that is associated with this outbreak. The suspected exposure types are identified there. 36% are homeless and illicit drug users, 17% homeless only, 12% illicit drug use only. That represents 65% of the total number of cases. This next slide shows that the age distribution of the cases overall, and as you can see, right after the vaccine was introduced, you can see a decline in hepatitis A cases. Fast forward to 2017, and most of those, actually the curve that is an overlay of the blue, light blue and purple, are 25 to 44 years of age, as well as 45 to 64 years of age, and that represents the predominant age range of cases in this outbreak. This graphic depicts the number of homeless population from the just-in-time homeless count that was conducted earlier this year. If we overlay the cases of hepatitis A related to the outbreak, we can see that the cases are concentrated in downtown city of San Diego and the city of El Cajon, but other cities are also involved, including our incorporated areas, Chula Vista, Santee, and Escondido. slide speaks to how we have managed the Hepatitis A outbreak. We have developed an incident command system to manage the outbreak. We convene meetings 3 times a week, 2 that are internal and 1 with our county-wide partners. We've conducted case investigations and post-exposure prophylaxis and surveillance due to the support from our regional task force on homeless database. We have and continue to work closely with the Department of Environmental Health on possible food sources and communication to stakeholder partners. But again, no food sources have been identified to date. The 3 strategies that we are using to manage this outbreak include vaccinate, sanitize, and educate. We have requested CDC staffing that occurred earlier this year in May. 2 epidemiologists were sent to San Diego and worked with our epidemiology staff for 3 weeks. We have met with HUD initially on April 18th, and more recent meetings in August have resulted in a formal TA request being made. As you all know, the CAO issued a directive to the City of San Diego on August 31st, and the county declared a local health emergency on September 1st. The next couple of slides, we have a slide for vaccinate, sanitize / hygiene, and educate. I will just do an overview, but this provides the detailed description of our timeline and activities in these 3 strategic areas. As it relates to vaccinations, the vaccination strategy began in March. Generally, we're working with service providers for the high-risk group where we are seeking out individuals and offering vaccinations where they live. And also individuals that are associated with the correctional facilities, as well as in inpatient treatment programs, are on the streets. We have recommended that the members of the workforce who have contact with at-risk populations also be vaccinated. This includes our substance abuse disorder program staff, emergency department staff, because of their contact with the high-risk population. We are using a unique strategy. We call them foot teams. They're going out into the field. We borrowed this from the military and our experience with the homeless outreach teams, where we take vaccinations to the individuals where they are in encampments, in the riverbeds, in San Diego. We've stationed nurses in the areas that are at risk, where our at-risk populations routinely access services. Over 7,300 vaccinations have been given to the specific at-risk population, and approximately 11,780 vaccinations have been delivered specifically at public health centers, community clinics, hospital emergency departments, and other healthcare systems. In total, we've administered 19,100 vaccinations. We've held 370 field events. These actually include events going out to the locations where individuals that are high risk are obtaining services. These include 356 mass vaccination clinics, 109 foot teams, and 5 mobile clinic vans. This next slide is just a picture that depicts our foot team vaccination efforts. And again, we have vaccinated 109. We have held 109 events associated with that strategy. Our next strategy is sanitation and hygiene. We began distributing hygiene kits to at-risk populations in April, and as of yesterday, we've distributed over 2,400 hygiene kits. We began meeting and having conversations with the City of San Diego, where the largest number of cases exist, in May. And these discussions revolved around sanitation needs. We've also cleaned up encampments in the lakeside community. We piloted the use of hand-washing stations, initially at the Health and Human Services Health Services Complex, or Rosecrans. And we began a more focused work with local food handlers and food facilities, and researched the City of Los Angeles Public Works Department's protocol for street sanitation. We've issued a local protocol for street sanitation to the City of San Diego based on CDC guidelines and protocols used by the City of Los Angeles, and have started to meet with El Cajon and will have identified other cities that will obtain this service. This slide depicts the hygiene kits that we are providing, and there's also a picture of the hand sanitation stations. Lastly, the strategy related to education has involved convening calls and presentations to the medical community. We've conducted over 50 presentations alone to the homeless service providers and substance use disorder treatment providers who serve our at-risk population. We have established a website presence for the hepatitis A outbreak, and we've issued health alerts and news stories, provided education campaign materials, and have engaged stakeholders such as the California Restaurant Association. We've issued 2 rounds of letters and educational materials, and we'll be communicating further with all of the stakeholders in the coming weeks. The Department of Environmental Health has sent a memo to fitness and recreation centers with public pool facilities on cleaning and sanitizing protocols. So in terms of next steps, we plan to, again, ramp up the strategic strategies that we are currently using. As it relates to vaccinations, we will expand efforts by increasing the number of foot teams above the 109 that have already been conducted, and expand the use of temporary nurses to vaccinate clients at substance use disorder treatment facilities and homeless service provider locations. We will continue working with other municipalities to implement sanitation efforts and expand education efforts, with convening medical providers meeting in the coming weeks, as well as homeless service provider meetings, and meet with other stakeholders, and distribute the 3rd communication letter and educational materials, as well as expand our education outreach to North regions. If community partners need educational materials or a presentation, they can contact our staff at the contact information provided here. I would like to thank the Board of Supervisors for their leadership in supporting the declaration of our local emergency, and thank you for the opportunity to make this presentation.
Dr. Wooten, thank you for an excellent presentation. I'm going to go to board members for any questions at this point. We do have 5 speakers that wish to address us on this. Supervisor Cox, did you have something?
Yeah, just a couple of questions. The number of people that have been vaccinated, the 19,100, and more specifically, the over 7,300 that have been given to vaccinations to the at-risk population, how far back does that go this year? Is that back to March?
Yes. That goes back to when we first started our vaccination efforts. And just so that you also know, the 7,300 that's the number that we definitely know have reached the high risk or at-risk population. But we know that our public health centers, the federally qualified health centers, and even in the emergency departments are also reaching those populations. So we are teasing out, we'll be working on teasing out those numbers so we can have a better representation of the overall effort to target the at-risk population.
I assume the vaccination is the best defense. Obviously, the sanitation stations are kind of a second preventative thing, but what we really want to do is to impress upon people that if they are in that at-risk population or they have not been vaccinated for Hep A, that they should get a vaccination. Is that correct?
Absolutely. Vaccination is the best strategy to prevent the hepatitis A infection. And so our strategy is to try to vaccinate as many at-risk population individuals, but also vaccinate those individuals that have close contact with our homeless and illicit drug users. And those numbers are also included in the other portion of the total 1,900.
And you've indicated we've had 109 foot teams out there actually making contact with at-risk population, and you indicated that's going to be actually increased. Do we have an idea of magnitude of that increase?
We will be working on the strategy for that next week, so we can report back to you what that strategy will look like. But our goal there is to increase those efforts, trying to get to the locations that we have not yet been to, specifically along the riverbeds.
Okay, well, it certainly looks like you've been working on this going back at least till March of this year. The declaration or proclamation that is before us declaring a public health emergency, I assume is certainly a countywide declaration. So while the concentration has clearly been in the city of San Diego and some significance in El Cajon, with this declaration, what are we expecting, and let's use city of San Diego because that's obviously the largest concentration. What is our hope and expectation that the city of San Diego will do in response to this public health emergency?
Based on the directive that was issued by our chief administrative officer last week, the primary goals with the city of San Diego are to, and we've achieved that over the weekend, placement of the hand sanitation stations, but more importantly, getting the streets cleaned and sanitized. So the city is working on a plan to present back to our CAO, I believe at the end of the week or early next week, but that was a discussion in a recent meeting that we had.
Madam Chair and Supervisor Cox, the 40 stations, hand washing stations, were installed last Friday and Saturday, and assessing even further sites that the city is identifying for us. So that was very important. And then, of course, the sanitation process of the streets that the city is planning to do, not only in the city of San Diego, but as we're talking with the other cities, that they have the authority and the responsibility to take on.
So maybe Helen, do you have any further?
Yes, Supervisor Cox, through the chair. There's a meeting this afternoon with the mayor. Both Dr. Wooten and Nick Mascione will be over there. I've been in contact with Scott Chadwick multiple times today, as well as several times throughout the week, this past weekend. They are making progress in determining what their sanitation protocols will be. So they are moving forward. I want to be clear, though, that the directive that I sent was for them to come back within 5 business days with when they will be in compliance with the sanitation, as well as having the hand stations implemented. The hand stations have been implemented now. They may be moved as they determine where they're most effective, and if there's an area where it's not really being utilized and we think there might be a better place, we can move them, or we may add. We've also offered to do that if there's additional locations that are identified. But I just want to be really clear that the directive was for them to come back with when they will be in compliance with those, and they are in compliance already now with the location of the wash units, and then hopefully very soon they will respond with how they will be in compliance with the sanitation efforts. Does that answer all your questions?
I think so. So at this point, they really haven't come back with a plan in regards to the sanitation of the streets.
I want to say there's been a lot of discussions back and forth. They are working very closely and very diligently on that. So absolutely, they are moving in the right direction.
Okay, thank you.
I had a question. Helen, could you clarify, why does the county, we're the public health agency and the public health director and the state of emergency, we're being asked to re-ratify. Why can't the county just go into a city and implement measures? Why do we have to wait for a city to respond?
Well, Chairwoman, that question might be better answered by council, but we don't have authority on where we can put things in a city. They have their own jurisdiction and they have their own permitting process. So we certainly have the authority to deliver stations, which is ultimately what I said. If we didn't have addresses, I would deliver 40 on City Hall. But they're working with us, and I don't in any way, shape, or form want to make it seem like they are not doing everything possible. They are. But we don't have jurisdiction on some of those things. When we brought our mobile van in to do the vaccinations. We have to park that, and we have to have a place where we can park that. And so we've been working with them on where we could set up those vans and where we could do those vaccinations. So we are working collaboratively with them, but we do not have the authority to just go in and usurp their authority as the city in their permitting process and their jurisdictional rights that they have.
Council, would you like to weigh in on that? Because I think there may be some confusion, and it just seems like we've got something in the way here of just getting it done.
Madam Chair, the CAO was absolutely right as far as where we have limits on authority. Excuse me, we do have the contracting authority as far as the stations are concerned. We do have the contracting authority. We are able to pay for those units, but the city has control over the right-of-way within the city's area, and so the city had to make decisions about where those things were going to be and to be permitted, so we have to respect their authority over their right-of-way. When it comes to the next phase of sanitation, where you are going to actually be going in and actually removing things and then cleaning that right-of-way, that is, again, an area where the city has the authority. The city is the sovereign there as far as determining how they would be moved. You'd have to have potentially the police force available to assist, and those are all city activities that the city would control in their jurisdiction. If you're in an unincorporated area, then the county would be involved. If it's a different city, then that other city would be involved with that particular area of its jurisdiction.
Thank you. Let me ask a more basic question. So we're asked today to ratify a declaration of local health emergency. Other than raising public awareness of the problem and what is being done by the county and the other jurisdictions, what does this mean? Is it like a declaration of when we have a fire? Does it bring in federal, state money? Because I know that not just the cities are being affected, the county's being affected, but also the hospitals are being affected. So does this bring us any help in any way?
Madam Chair, the declaration of the emergency, this is not a local emergency that we would traditionally do with response to a fire or some other kind of an emergency, in which you would have pretty much automatically that you would be looking to the state and to others for funding and for the mutual aid of all the groups being combined, fire, police, and all that to be involved. This is a local health emergency. We are able to trigger some mutual aid, but only as to the health-related activities. There's also some immunities provided as related to the health activities. There shouldn't be really any expectation that there is necessarily going to be funding available from the state or the federal governments, although that is certainly a possibility. As you mentioned, I don't think that is the primary goal of this. The primary goal is to raise awareness and to make sure that we have jurisdictions working together to resolve the issues on the health-related activities.
Thank you. Supervisor Roberts?
Thank you, Madam Chairman. I need just a few minutes to ask a couple questions. First of all, 19,000 plus vaccinations is really impressive. It's kind of been overlooked in a lot of the discussion. I mean, we've had teams out in all sorts of areas now, and I know we're even working where the police are helping us to get into areas where we might feel uncomfortable going, but we've sent our public health people into those areas. 19,000, in the report though, you said 19,000 plus people. And when you started the report, you said it's really a two-shot sequence. So are we talking that, help me with the numbers. How many people have actually had two shots?
So far, we've been working on that first series. We realized that we will have to develop a campaign to circle back and get the second shot. But we do know that the first shot does confer significant effectiveness against the infection. So our first and primary goal was to get that first shot into as many people as possible.
Okay, so that probably represents a real number of people. And at some point, So the one shot's effective within how many months do you need to get the second one?
Oh, 6 months.
Within
after the
6
first,
months?
Yes, 6 months
Okay.
after the first vaccination.
So to the extent that we have located and can relocate some of these people,
Well, that's the challenging effort that we've had throughout this outbreak. The outbreak is in a population of homeless and illicit drug users that move around, and trying to identify them is very difficult. Early on, Dr. McDonald and his epidemiology team worked with the emergency department so that they would call them while the person was still in either the ED or the hospital, so we could talk to the individual. Because very early on, we lost individuals and we couldn't get information on them.
Okay.
But as you can see in the numbers on the demographic page, it's actually a small number of people for which we don't have any information.
okay?
But what we are working with the regional task force on homeless and their database to identify individuals. And so we will start the next round, actually, fairly soon in terms of trying to get the second round of vaccines in individuals, and we will work with our service providers to do that.
So we really have to publicize the fact, if you had one, we really want to see you for a second one. Make sure we get that message out. Heretofore, we've been talking about this like it's a City of San Diego issue, and yet you showed a chart, that one right there, that shows that Chula Vista, Escondido, El Cajon, these are all significant areas of concern. Are we working with those communities? I know pretty much the things that are happening in San Diego. Is the outreach with those communities and the follow-up, and to what extent we can get them to be spraying the antiviral chemicals on the street? Are those things happening?
As it relates to sanitation, we have already begun meetings with El Cajon, and we will begin to meet also with National City and National City, as well as Vista and Escondido, all of the locations where a significant number of cases are identified. We are reaching out through our regional directors in the regions to facilitate those communications, but we've already met with the city of El Cajon.
Okay. You mentioned the Regional Task Force on the Homeless, something I know a little bit about. And that's really our continuum of care organization. And in August, based on a request from the Regional Task Force, the Department of Housing and HUD, Housing and Urban Development, is going to be offering assistance to us on this issue too, and I'm sure you're aware of that. Now, part of the reason that happened, we had excellent presentations. You introduced Dr. McDonald. You didn't introduce Dr. T, and I'll call him Dr. T, but I'm sure you can pronounce his last name. But he has been very effective. He's made presentations to the Regional Task Force. I've had him at special meetings with the mayor and his staff. He's really very, very, very knowledgeable on this issue. And I want to thank him, but you should properly introduce him.
Yeah, during the education description, I shared with you that Dr. Seon Thihalolipavan has provided over 50 presentations to community stakeholders, the homeless population, our substance abuse population, and as Supervisor Roberts stated, the Regional Task Force on the Homeless. So he's been doing a great job. He's the Deputy Health Officer for the County of San Diego.
Yeah. One of the things we've done, it's not just getting the people on the streets. You got to get the people in the shelters and everywhere else, people that might be off the streets in a short time. And we've tried to build that bridge to numerous organizations. We probably have maybe 40 or 50 of them in attendance at these meetings, and that's why his presentation's been so important, to let them know we will come to your facilities and we will vaccinate and we will take care. You got to help us, though. You got to help us to build that bridge. Extremely important, because some of these people will be back out on the streets, and this virus, it lasts for a long time. That's why the spraying is so important. I was told a long time ago, when you wash your hands, you got to wash them long enough for it to be effective. You got to sing happy birthday twice. I don't know if that's true. But yeah, I got to tell you, there's not going to be many people washing their hands that much, that long. So the vaccination and the spraying in Los Angeles was extremely important. So I'll be anxious to see that get started.
Supervisor Roberts, just to add, because of the Regional Task Force for Homeless has been highly instrumental through the members of the presentations, but we're not just doing Hep A vaccinations. As we're engaging with folks who are identified as homeless, we're engaging folks who are identified with substance use disorders, we are also having that brief intervention of trying to link them to service. And so our aim is getting people linked into housing and services off the street. So I don't want that overlooked, that as our nurses, our county nurses, our social workers are out there, we are also taking that effort to link people into services so they're not in that predicament and cycle of the issue of outbreak like Hep A.
Yeah, and I wanted people to understand that. I mean, this is like a big iceberg, and there are some people that just look at this little tip, and they don't know about all these other things and the effort that's out there. If you're going to beat this, you got to beat it in the priorities that have been given. You know, the vaccination, there's no question. You know, that is absolutely critical. 19,000 is pretty impressive.
Just to make that point, pick up on your point on the 19,000, that is an impressive number. And I think it demonstrates where the county has had the authority to act quickly and to move on this issue. That 19,000 in vaccination demonstrates that, where the difficulties have come in is where we needed permission, in this case, from the city to do certain things. So I think that's a really, really important point. But I'm glad everybody's working together now, and that's what I think is significant. Hopefully, that kind of thing with the other cities will happen sooner rather than later. So I thank you for that.
The cooperation we're getting is really region-wide, and it's not just with cities, it's with individual organizations. If you don't have cooperation, you're not going to get anywhere. It's not a matter of us versus them or anything else. You've got to work together on this. We can beat this. We can make these numbers dramatically different. But you've got to do all of these things, you know, and you got to, the public awareness of what this thing is all about. I mean, most people never even heard of Hep A not too long ago. All of a sudden, it's a major crisis. No, it's not at the point where the governor's declaring this a state emergency. I'm not quite sure what you have to do to get to that level, but we have the resources. I think everybody is working together on this, and we can turn this around. I'm confident that we're going to.
We do have 5 public speakers, and Mr. Clerk, would you please call them up at this time?
Thank you, Chairwoman Jacob. I'd like to invite forward Councilman David Alvarez, followed by David Garcias, Catherine Rhodes, Paulo Montes Martinez, and Ed Blitz. You'll have 3 minutes to address the board. Please begin by stating your name for the audio record.
Thank you, David Alvarez, council member from the city of San Diego. And I want to thank the chairwoman for the opportunity to speak today. I also want to thank Dr. Wooten for the very excellent presentation on the information background on hepatitis A and what's happening. I think that's critical that San Diegans find out about what's happening, and I appreciate that. Obviously, ratifying the declaration of a health emergency is the right thing to do today. But for many of us, we think that it is long overdue. I again want to thank Dr. Wilma Wooten for recognizing this emergency last week and declaring the emergency. Her action has allowed this issue to be discussed today and be even more discussed in the public. Dr. Wooten, county nurses, and other public health officials and the teams that you have on the ground have been acting with the courage and urgency that too many in this town seem to lack. 15 deaths and hepatitis A increasing and still spreading merits everyone acting with the same sense of urgency. And to that effect, I want to thank the chairwoman for her questions and comments about getting to work quickly and taking action. That sense of urgency, I believe, that is lacking in our own city is what brings me here today. Not taking your requests as serious as they are, and finally, I understand the first order that was made was to install these sanitation stations, and 40 of which are out there, took way too long, and certainly seems that bureaucracy and red tape got in the way, not by the county, certainly by the city in this case. Immediately expanding your second order, immediately expanding access to public restrooms in the city limits to at-risk populations, I don't know where that's at. Have all public restrooms been made open and available? Public facilities at places like the Convention Center, at Petco Park, at all city and county facilities? We don't know that. That needs to occur. And the fact that the cleaning hasn't occurred, even though the city just moved homeless off of our sidewalks yesterday and had the ability to go in there and actually clean these streets or these sidewalks, and it didn't happen, should be of concern to all of us. The lack of action is really what is concerning here. Finally, you can vaccinate as many people as you want. You can put as many hand washing stations out there as you want. You can open as many public restrooms as you want. This problem is due primarily, as was stated, because of our homeless crisis that exists in our city and in our region. And until we act to adequately house homeless, and we do not allow them to continue to camp out where they can go to the bathroom and continue to spread hepatitis A by doing what they have to do, their physical needs, this is not going to be contained. I urge that we open our public facilities now. We eliminate public camping, use city facilities, use county facilities, and house homeless indoors and not allow the camping to continue. Thank you very much for the time.
Thank you, Councilman. Next speaker, please. I don't want any of the other speakers to get the idea, go over your time. The councilman, as an elected official representing the city here today.
Thank you. My name is Paulo Martinez Montes, and I'm the director at ACE. It's the Alliance of Californians for Community Empowerment. We organize in Districts 8 and 4 in the city of San Diego, and then in National City and Chula Vista. We organize primarily low and moderate income families. And I'm here today to support the county's declaration of emergency to deal with the hepatitis A outbreak. A lot of the folks that we organize and in the neighborhoods where we organize are severely affected by the homeless population because they're not only sort of on the outskirts of the cities anymore, they're living within the residential areas as well. And so I'm here today to support the county's declaration of emergency, and on behalf of the Invest in San Diego families, which we're also part of, we are here to say that we can do a whole lot more to address the needs, and we have the following recommendations of our nurses who support the county staff, which support the county staff and public safety. So one would be to deal with the staffing crisis. In addition to temporary staff to help manage the hepatitis A outbreak, the county needs to add a minimum of 40 permanent positions where patient ratio is above the state recommendation and chronic use of overtime is being used as a Band-Aid for understaffing. The county has a surplus of $1.7 billion, which should be utilized to provide the appropriate staffing levels to meet the needs of our community. So 2 would be to establish written safety protocol for nurses on the front lines for outreach and vaccination teams. And number 3 would be provide proper safety equipment and supplies to keep employees safe. And 4 would be to bargain in good faith with the SEIU 221 employees who, just want a fair contract. And will help to address also the massive turnover among public health nurses so that they can focus on the task at hand instead of trying to keep up with the recruitment churn. So thank you very much for your time, and we'll see what steps follow. Thank you.
Thank you. Next speaker, please.
David Garcias, I'm the president of SEIU Local 221, and I got excited when I saw David Alvarez go over, so I was thought maybe I'll get a little bit more time, but I guess not.
David, don't get too excited.
I'm president of our local that represents 10,000 county employees. The fight against the Hep A outbreak is very concerning, very serious, and I want you to know you will have your most valuable resource, which is your county employees that go out there every day and fight those battles. The nurses who are not only caring for the children, the elderly, and the homeless, but then have to shift their caseloads, but then they're going out there and they're actually out there in the areas where the homeless are, sometimes without law enforcement, and they're out there dealing with taking care of the clients out there, as well as social workers out there working with the PERT teams, assessing folks that are out there, eligibility workers that are talking to folks in the family resource centers, the environmental health inspectors that go out and inspect, and even I was talking to a nurse the other day. There's a nurse that's in charge of making sure the vaccines are maintain the right temperature. And if they are outside of a certain period of time, they cannot be used. So she has to monitor that, when they've been out, how long they've been out, when are they refrigerated. And they're making sure these things are taken care of so that we can keep the fight going forward. And, I'll say Supervisor Horn, as a former member, or as a Marine, the military slogan is, they are the tip of the sword. They are out there in this fight and fighting for all of us and making sure that we are, our community is safe. And we appreciate that this meeting and you're taking the leadership to move this to an important level so our fight can take on a different, we can start moving faster and quicker and getting things done. We would like to work together in the future on prevention, and we are in this fight too. And we must fight together. So I'm here to say the 10,000 county employees represented by SEIU 221 are ready for that fight, and we are in it together. Thank you.
Thank you, David. Next speaker, please.
Good morning. My name is Ed Blitz, and I've lived in Bankers Hill since last October. So, Diane, you'll be happy to know I'm not here to talk about the airplanes at Gillespie. Anyway, I am here to urge the board to take every step necessary to address this Hep A crisis. I'm also here to tell you that this crisis does not only affect the homeless population. If estimates are correct, that 70% of the cases are with the homeless population, then 30% of the cases affect the mainstream. I'm not homeless. I don't work with the homeless. I'm in the mainstream, and I did contract Hep A. So, I did contract Hep A in June. I was very ill for 7 weeks. I'll spare you all the details, but to say I needed 7 blood tests and a liver scan. It was quite horrible. I spent a long time with the health department going over my movements for the weeks prior to my outbreak. Their conclusion was, and I quote, "We'll never figure out where this came from." So I urge this board to step forward and use every means possible to battle this crisis. Setting up hand-washing stations is a step in the right direction, but much more has to be done. Thank you.
Thank you, Ed. You can come down and talk about airplanes at Gillespie anytime you want. Next speaker, please.
Hi, Catherine Rhodes, and thank you very much for this declaration. Every Tuesday on your Hepatitis A website, you say how many people died, and, I was waiting. Did anybody die this week? It's usually updated every Tuesday, but because of Labor Day, it's one back. So it still says only 50 people have died, but then it says, please note, the table does not include all reported hepatitis A cases in the county, only those that are local outbreak related. Also, data is provisional and subject to change. I want to know, did anybody die last week?
We'll find out after you're finished.
Thank you. The next thing is when I started reading things to do with Metropolitan Transit Service in Sandag, I saw that through the Federal Transit Administration, people for ADA compliance, people are supposed to be able to have restrooms. We don't have any restrooms. What happened in 2013, the city and the county, everybody, Civic San Diego, they got together to do the pilot project for the Portland Loos. So we've already done every pilot project we have. We put the 2 Portland Loos in, and what happened is we were sabotaged by Civic San Diego staff. For example, instead of giving us our sewer lateral for the project, what they did is they gave it to a pop-up park. And so we had to drill underneath the trolley tracks that jacked up the cost. They said we couldn't use community parking district funds for, we could only use them for the maintenance. We couldn't use them for the security. As part of our urban restroom network report that came out on the mayor's task force on downtown restrooms, we recommended that they have attendance and they have security. But again, we were sabotaged by city staff, the same people I'm sure that sabotaged you. One of the things I also wanted to mention is in Flint, Michigan, 12 to 15 people got Legionnaire's disease. 3 people that are government officials are have criminal complaints against them for involuntary manslaughter. You guys have that. You guys has 15. So you're as big as Flint, Michigan, just with this issue. And of course, you know, the solution, of course, is to use all the money that's just hoarded by, staff. And if we could actually get a audit from the county of the City of San Diego's assessor agency, it's free to you. You don't have to pay any money. It's already pre-approved. And the Low Moderate Income Housing Fund and the Section 8 HUD funds that San Diego Housing Commission was hoarding for years, and now they're finally saying that, oh yeah, we can have that. It's not necessarily cash reserve fund balances. Thank you.
Thank you, Catherine. Thank you.
That concludes public testimony on this matter.
Thank you. Just a couple of comments. One, I wanted to correct one of the things that one of the speakers mentioned. The county has approximately $747 million in unrestricted reserves. And that's why we have these unrestricted reserves, because of situations that we're dealing with, like today, that we have that money to draw on as other events may occur. But the item today in the special board meeting, as we heard, is a part of a very serious Hepatitis A outbreak. It's clear to me that the county has been very aggressive. About 20,000 vaccinations every month since March. I'd say that's an A in my book. As the lead public health agency, I know that the county is going to continue to promote the hand washing, the other good hygiene, provide the vaccinations for the homeless, first responders, and anyone else that's at risk of the disease. And I applaud the efforts of all that have been involved in that. Under state law, though, I want to make it very clear that cities are responsible for sanitary conditions within their areas, within their jurisdiction. But along those lines, it's important that the county continue to work with the cities and other jurisdictions, not just the city of San Diego, to combat this outbreak. We do have a crisis, but the strategy that's been laid out by staff, I think, is very clear: prevention, vaccination, and sanitation. So with the declaration, we can further raise public awareness, which I hope we've done today, and I thank the media that is covering this today, and then move closer to ending this outbreak. The one good thing, it's not like polio back in the day where we did not have a vaccination. We do have a vaccination for this, so it's just getting to the people and following up with that. So Supervisor Cox, then Supervisor Roberts.
Thank you, Madam Chair. There was one question in regards to, that was raised by one of the speakers in regards to the total number of fatalities that we've dealt with. It was 15.
Yes, the numbers that were posted on the website late yesterday, which are on there today, are the ones that are the most accurate. But it's worth pointing out we have 44 cases that are under investigation that we call suspect. One of those is a death. That death occurred in mid-August. There is usually a time delay between the time a case happens, a death occurs, we find out about it, we do an investigation, we add it to the numbers. So one shouldn't think that the numbers that are being posted on the website are real-time numbers for what's happening now. It really is a delayed picture of what happened a number of weeks ago. But right now we only have the one death that is pending investigation, and it may turn out to be part of this outbreak, it may not.
So it's 15 officially, and it may go to 16 based on further studies?
That's correct, Supervisor.
Okay. Well, just a couple of comments. Obviously, this is a very significant issue, and it's one that I want to commend our staff, both in the Public Health Department and our front line, our healthcare workers, for the outstanding job they've been doing, because, I mean, you've identified this as an outbreak that had to be dealt with going back to early March. And so it's not something that we're, kind of late to the party in trying to address. Obviously, it is culminating today with this declaration of a public health emergency, because it is continuing to be an issue that has to be dealt with. I guess maybe the encouraging news is when you look at the chart you had in regards to the number of cases, outbreaks week by week, it's trending down, but as you identified, there's an incubation period of 15 to 50 days, so we don't know whether that's going to be a trend that'll continue down or may spike back up. But I think the County of San Diego, the staff, again, kudos to you for being as responsive as you have. I just want to clarify one point. I think the 19,100 inoculations has been a cumulative number. Is that right, since March? And hopefully that number will continue. And again, it was pointed out by Supervisor Roberts, we've got a task to make sure we can get that second follow-up shots, which I think you said is probably September is about 6 months later from March, so it's about time for those that got the initial shots to come back in. This is an issue that is symptomatic of a bigger issue, which is at a crisis level, and that's the whole issue of homelessness. Now, obviously, as was demonstrated by one of the speakers, you don't have to be homeless to get Hep A. So it's an issue that we need to look at in a much broader context. But I think by taking this action today, we will hopefully be in a position to work with the other city of San Diego, certainly, and the other 17 cities to make sure that they're taking the steps that they need to take, that we will be taking the steps we need to take in the unincorporated area to try to make sure we provide clean and sanitary facilities for people to wash their hands. But it just kind of reemphasizes the fact that we need to do a better job as a region, and I include the county and all 18 cities, in dealing with the homelessness crisis that we have. And I commend Supervisor Roberts and Councilman Chris Ward for the work that they're doing to the Regional Task Force on the Homeless. I think that's a part of the solution, but it's going to be, as was pointed out before, it's going to take everybody working together in a cooperative vein. We don't need people pointing fingers at each other. We don't need media, beating up on different people. This is an issue that's going to take all of us working together, and I think that we've got the right mix of people and the right support system out there. It's great to see the cooperation we've had from the some of the other, not only nonprofits, but the Food and Beverage Association and the Restaurant Association, and the outreach that they're doing to their employees to ensure that we're approaching this in a much more holistic manner. So with those comments, I would offer a motion to accept the staff recommendations.
I'd second that.
Supervisor Roberts, you're
Yeah, Supervisor Cox picked up one of the things. We want to make it clear that the 19,000+ was the total number, not a monthly. And I think most people understand that. And there's a lot that is going on with respect to the homelessness issue, which certainly this is exacerbated because of that environment.
And I exaggerated, didn't I?
I don't think you intentionally did it.
I didn't.
Yeah.
Thank you for correcting me.
But it's not a problem. We were going to slap you later, but that's okay. The steps that this board took earlier this year with respect to 11 major pieces of property with $25 million, with a $500,000 special fund that's been set up. We will be bringing pieces of that back here in the not too distant future so that we can begin the actual development. Reducing homelessness is certainly a goal of this board. I think it's a goal of everybody in this region. I'm not finding anybody that doesn't want that to happen. When that happens, things like this should also, that's a preventive measure in a sense. Education's a preventive measure. We've got a lot of work to do, but none of us should feel that these things have been ignored. And I think we have to continue to focus in each of your districts, connect with the cities, let them know how can they be a part of our programs here. A lot of them are kind of, even though they have cases and they have homeless, there's no question about that. They're kind of, not sure that they need to step up to the plate. We need everybody throughout the whole region to be a part of this effort. So I'm delighted to be able to second the supervisor's motion, and I want to compliment Helen and the staff because I'm telling you, everybody, we see the top people here. David mentioned, one of our most important assets, our most important asset. Our public health nurses are fantastic. I cited one of our public health officials, and he's been, I'm not surprised to hear he's been to 40-something, made 40-something different presentations. I mean, I feel like I can give this presentation almost, not with authority, but by memory. So there's a lot of things happening here. We get beat up over sometimes maybe it doesn't appear things are moving fast enough. The important things, the really significant things are moving and moving fast. And we got to keep focused on the priorities here. So let's keep going.
We do have a motion and a second. I just wanted to clarify we have more than streets to clean up. And in District 2, we're cleaning up culverts and riverbeds too. So we've got the problem in more than just the streets in the cities. Okay, please vote.
Chairwoman Jacob, that motion passes unanimously with all board members being present and voting aye.
Thank you all very much, and thank you for attending today and for your input. And we do have one closed session item, and the board will adjourn into closed session at this time.